Well, we're back with Dr. Shannon from Northridge, a dentist. Dr. Shannon.
Yes, Helmut.
Another area where dentists help out a lot, and people don't necessarily realize is facial structure. Basically, how good do we look? Now, I know we do realize that we look good with nice, beautiful white teeth in it, like Julia Robertson or Tom Cruise, having $1 million smile. That's all nice and dandy. We know all about that. But there is more to it. For instance, when a person has teeth missing and opts for a denture, or has a bunch of teeth missing and doesn't replace them in any shape and form, there are many ramifications, but one of them is that his bones start shrinking and he starts kind of looking like a dried out tomato, like a little hex, like a little witch. Is there something to it? Tell us about it. Tell us how this comes about, why, and is it really true that putting on, not letting that happen, not letting the bone shrink, can take off 5, 10, and more years of your look down the road?
Well, yeah, you basically hit it right on the head. When you have teeth in your mouth, they stay in there because you have bone that holds them in. So as you lose your teeth, there's no reason for the bone to be there anymore. And the body is a very efficient machine, and it says, okay, there's no tooth, let's get out of here. And the bones start shrinking. And as it does, things start falling in, and as you say, you start looking like the Wicked Witch of the North there from The Wizard of Oz. So the whole idea is if you can keep your teeth in there, then you can keep the bone. Now, if for some reason in your life, whatever that reason might be, you had to lose a tooth, or you have to lose a tooth, then you want to replace it right away. If you replace it with something like a denture that just fits over the gums and fits over the bone's still going to shrink. And that's why if you talk to your grandmother or your great uncle or something, and you talk to them and you ask them about their teeth, they have to take them out of their pocket, put them in their mouth to tell you, oh yeah, they work fine. Well, they don't like wearing them because they're loose and they flop around, because the bone will continue to shrink even with dentures. But if you place an implant in your mouth, that implant goes into the bone and kind of fools your bone into saying, oh, there's a tooth here, I need to hang around and keep it strong and healthy. So the bone stays, and therefore you don't have that sunken look and you don't have that bone shrinking away on you on a long-term basis.
Interesting. So let's say a person comes in with dentures which have been loose already. Quite often those people think that those dentures are they're faulty now, when it really is that their bone were shrinking. It's like if you lose or gain weight, your pants don't fit anymore, right?
Right. Can't blame your pants when you're eating 2 pieces of apple pie every night for dessert.
Well, I tried that yesterday, and my wife was almost believing me. So the point is, now with the new methodology, I heard that you guys have a way now that you can still make dentures, but you can actually fix them with a couple, 2, 3 implants, where now you avoid some of the pressure, some of the thing, and at the same time you give the bones again the feeling that there are roots in it, to a degree at least. Can you tell us about it?
Right. Well, if someone has lost all their teeth, they're wearing a denture, let's say for 20 years. And for 20 years, they're struggling along with the teeth. Some people, of course, are happy with them. I won't say every single person is struggling with their dentures, but, their teeth are in their mouth and they're not fitting quite right, and, they're not eating corn on the cob, and they're cutting things up before they eat it. They don't bite into the apple. They slice it with a knife, and they whittle things down to make it comfortable, and they chew it up. That person comes into the office. We talk to them about the actual denture itself. What are the drawbacks of the denture? A lot of people don't realize that if you haven't seen a denture, it has a whole piece that goes across the roof of the mouth, and that's the palate. And the palate has a lot of taste buds on it. So when you're eating and drinking things, when you wear a denture, you're missing a lot of the taste as well. Well, what we can do is by strategically placing a few implants in the mouth, we can change the shape of the denture where we actually remove the palate area on the denture, not in your mouth, but on the denture. And now you've just got this horseshoe shape of teeth that will snap and click and lock into these implants, and that'll allow you to taste things again. That'll allow you to speak without a whistle or a lisp. It'll just make things a lot more natural. And again, as you brought up those areas where we're placing the implants, the bone now thinks there's a root in there, it's not going to shrink, and it's going to maintain that level, so it's never going to wobble, it's never going to need to be replaced, it's going to be able to last you for as long as you're able to chew. And you'll be able to chew everything, corn on the cob, you'll be able to chew, crunchy nuts, whatever it is that you can't chew with a denture that you have to work around, no more.
And at the same time, prevent a major cave-in of the bones and thus a major cave-in of your cheeks and everything.
Exactly.
Beautiful. The dentist,
it's a wonderful thing.
Keep your teeth, and if you cannot keep them, or if whatever you did, that they are out, get them fixed, get teeth replacements, get implants, and you will avoid a plastic surgeon down the road, which you might just simply need. Good. Thanks a lot, Dr. Thanks a lot, Dr. Shannon.
You're